Hello and welcome to the Motivational Midwife. I'm Lynn Jones, and today, as part of our Back to Basics series, we'll be looking at respiration rate and oxygen saturations. So, RESPs and O2 sats. So it's probably one of the most important of the vital observations that you will undertake, because it's the first one that will really alert you to the fact that there's something wrong, that this is the first one that usually increases to tell you that this woman you're looking after is deteriorating. So in simple terms, really, respiration is just the act of breathing, and it is an involuntary, although you can you have some control over how you breathe. Generally, it's an involuntary response that's controlled by the respiratory center in the brain, and it's very finely tuned to respond to levels of carbon dioxide and oxygen in the blood. So although you can override it and slow your breathing down or quicken your breathing up, if we had to think about breathing all the time, we wouldn't really be able to do anything else except consider that we have to breathe. So it is an involuntary response. But it uses far more than just the lungs. We need the ribs and the intercostal muscles, so that's the muscles in between the ribs, and the diaphragm, and they all need to be functioning properly in order to have good respiration. And the normal adult rate would be between 12 and 20, and that's breaths a minute. And there's a lot of things that will affect the respiration rate. You know yourself, if you go for a run, your breathing increases because your oxygen requirements actually are increased as well. Likewise, if you're sleeping, your respiration rate will reduce. If you get very anxious or nervous, you often find that your respiration rate has increased. And obviously, if you're in pain, your respiration rate increased. So if we think about the women we care for, particularly in labour, they very often are in some level of discomfort, so that you might expect their respiration rates to be on the higher end of that normal range. If there are any sort of complications such as a pulmonary embolism, so that's a clot in the lung, then that can also increase those respirations. And infection, because particularly sepsis, increased respiration rate, infection increases the body's need for oxygen, and therefore the respiration rate will go up in response to that. Anemia, obviously, if you are lacking red blood cells, we need that hemoglobin to carry the oxygen around the body. So if we have less of that going around the body, the body is going to work harder and breathe harder to try and get more oxygen in. And as I've said, obviously the respirations adjust to how alkaline or acidotic the blood base balance is, your acid base balance in the blood, so it will adjust accordingly. So it's pretty clever. And then there are certain medications that we use that will do what we call depress the respirations, and I think probably the one we maybe most use in maternity would be pethidine. Pethidine is a respiratory depressant, so not only for the mother but also for the baby. So if she has pethidine in labour, it will cross the placenta, and that's sometimes why these babies don't breathe spontaneously at birth, depending on the interval between having had the pethidine and when the baby arrives. But it's important if the mother in labour has had any opioid analgesia, that we do monitor her respirations quite closely. So things like diamorphine, pethidine, to some extent even your epidural, because there are opiate-based analgesia in there. Magnesium sulfate is another one that you may see used in eclampsia. and also for neuroprotection in preterm labours, and that is also a respiratory depressant, so you need to be carefully monitoring the respirations if they're in use. So when you're looking at someone's breathing, what are you looking at? So you're looking at the rate, so it's essentially how fast are they breathing, but you're also listening. So are there any sounds that might alert you to an airway obstruction? So is there any sort of wheezing, or does it sound like she's struggling to breathe? How deep is she breathing? Is she taking really big that might suggest that something is not quite right? And is the breathing pattern regular or is it irregular? When you look at the chest, have you got what's called bilateral chest rise? So is the chest rising on both sides, which would tell you both lungs are inflating when she's breathing? And have you got any signs of cyanosis? So looking at the lips, the mucous membranes, do they look slightly blue or do they look nice and pink? And if she is what we call hypoperfused, so a lack of oxygen, then that lack of oxygen will be also a lack of oxygen in the brain. So is she muddled? Is she confused? Because that would alert you to definitely tissue hypoperfusion is going on here. And that is something that potentially will flag up for any of your shocks, so hypovolemic shock and neurogenic shock, septic shock, any of those shocks. Potentially, if you've got tissue hypoperfusion, you may get this change in her level of consciousness. So how do we monitor the respiration rate? Well, if she's got a nice regular breathing pattern, then count for 30 seconds and double it. But if there is any irregularity in that breathing pattern, then you really do need to count for a full minute. Excuse me. The easiest way to do it really is while you're taking her pulse. So while you have her hand on her pulse, you can just rest her arm across her chest, and then you'll be able to feel her breathing rate at the same time as you're taking her pulse. So you can just carry on standing there, and they will just assume that you're carrying on counting their pulse. The issue about letting someone know that you're taking their respiration rate is that usually adjusts the respiration rate. People are aware you're counting it, and it often becomes quicker. And when are we going to undertake the respiration rate? Well, again, it's part of any admission to hospital to give you a baseline, part of that holistic assessment to give you a baseline rate. As part of your holistic assessment in labour, if they are having any sort of surgery, so elective or unplanned cesarean sections. If you notice any change in their breathing, if you think that it looks either a bit slower or a bit quicker, or they seem to be struggling a little bit, then it's prudent to undertake respirations. If they've suffered any trauma or hemorrhage, and of course if they suffer with any respiratory disorders anyway, so asthma, emphysema, although we don't get too many women with emphysema, but any sort of respiration dysfunction, it's usually a good idea to keep maybe a closer eye on those respirations. So closely linked with respirations, of course, are oxygen saturations, and you may or may not have seen these little gadgets. These ones are, it's called a pulse oximeter, and it just attaches usually to the finger or a toe, and it essentially measures how much oxygen the hemoglobin has in the blood. You get a result fairly instantaneous, usually within a few seconds. Things that might affect it, of course, are nail varnish. Gel nails are a particular challenge for pulse oximeters. So it may be that you need to put it on a toe if you can't get the nail varnish off one finger. It is much more accurate to really have bare nails and not really have any sort of varnish on there. And that saturation level we would expect to be above 95%, because it's measured out of 100%. So as you can see on this one that's on the screen, she's got 99% oxygen saturations, and her pulse is 75, because it will give you a pulse reading as well as the O2 sats. And there you have it, respirate and oxygen sats. I hope you found that useful. If you haven't subscribed to the channel already, please do, and I look forward to seeing you next time.